So I've got a clicker and a microphone and cards, which is one too many things to hang on to. So this is kind of a story, and that's how I'm going to tell it. About 10 years ago, almost exactly 10 years ago, my mother died very abruptly with no warning, which left me to contend with my father's Alzheimer's diagnosis and my brother's autism-related disabilities. And it was immensely difficult. Over the course of 4 years, I think we had 8 different social workers attached to our problems, and none of them were really able to help because they can only navigate you through systems that exist, which in this case, they did not. So coming into this, my role is as a sibling, but I am also studying disability studies. So I wanted to take my personal experience and then shore it up with evidence-based learning, which is what I approached in this practicum. But first, I have to tell you, dealing with my family issues was extremely lonely. It was very isolating, and I couldn't find anybody else that was dealing with the same things. I couldn't find any other siblings. So when Inclusion BC put out an invitation to family advocates to come to a retreat in Vancouver, I signed up with no idea who Inclusion BC were. It was a free trip to Vancouver and a chance to interact with other advocates. They were parents, not siblings, but it was a very welcoming atmosphere, and I really appreciated that opportunity. And I did get to learn what Inclusion BC does. They were founded in 1955 by a group of parents who believed that their children should be included and have access to the same opportunities that everybody else does. And 1955 is important, I'm coming back to that. So when I started this program, I had a realization pretty early on, and that was that all the crappy stuff that happened to my family was not just bad luck. It was systemic. The policies that are written to protect elders are not designed to work with the policies that protect people with disabilities. And I kept falling into the gap in the system over and over and over again. And I had thought that we were just unlucky, that it was a series of misfortune, but actually with the knowledge that I was gaining in this program, it quickly became apparent that you could track this stuff. Like if you'd gone 20 years back, the dots were there to connect. The second realization I had, which was when we were doing the social model of disability, is that Inclusion BC started in 1955. That was at the root of the inclusion movement. That was the groundbreakers. Those were people like my mother. So at this point, those groundbreakers are hitting their 80s and 90s. They're not able to be caregivers anymore. And we have never had this many people with complex disabilities living in community. So I wasn't alone. I was just the start of a wave beginning to hit shore. So I explored, I looked around, and this is the closest thing I could find to a textbook. It's the Sibling Survival Guide. It's about 200 pages. It's got dating advice in it, and it is an excellent start. But I was a textbook case, and nobody had written the textbook yet. So I dove into research on this practicum. That is my cat. His name is Ethics, so I got ethics approval on that. And I dove into the research and very quickly realized you can't dive into that. There's not enough to. So I kind of splashed around in it a bunch. And I found a lot of issues, just 1 or 2. So the themes unpack is a bunch of things that look really familiar to us in PHSP. So I went to the people that were leaders in this area, and I showed them what I'd done, and realized pretty quick in talking to them that nobody really has the edge on this. Nobody's ahead on it. Nobody has solutions. At this point, we're mapping out the problems, which is kind of what I ended up doing in this practicum. And looking back on these things, there are a lot of PHSP skill sets that will be relevant for untangling these issues, for building up support for siblings like me when they find themselves stuck as caregivers in difficult situations. We definitely need more research. So that's kind of what I came away from this practicum with. It felt like I'd gotten very little done. Mostly I'd just been collecting problems. But it needs to be done, and it's really fired me up. I'd like to come back and maybe do a master's in this, because I think it bears more investigation. I wish I'd gotten a little farther. So moving forward, my time is up. Moving forward, I would just say that we need more research on this stuff, and we need to talk about it a lot more. So thank you to everybody that was involved. I really appreciate it. And special thank you to Carla, who was my practicum supervisor. Thank you.
Well, Audrey, thank you for sharing your journey with us. That was wonderful. Any questions?
Really more of a comment than a question. I'm just speaking to what it was that you so clearly demonstrated about the state of play in this arena, Audrey. A PhD student of mine, Sandra Markey, and I just published a paper with Nigel and a few others that actually documents the prevalence of developmental disabilities in British Columbia. And if you think about that in light of all that we know, the prevalence of disability in 2018, you know, public health and the kinds of determinants of health that we're talking about, prevalence was established for almost everything between 50 and 100 years ago. And yet we're publishing a paper that is, quote, groundbreaking in British Columbia on what is such an elementary idea. So I think, you know, you're not alone in your journey. It's just that we need to collect the stories and build the capacity to bring forward the issues more clearly.
Yeah, I agree. And I think one of the big issues is aging. We've never had this many people with complex disabilities living in community, but we definitely haven't had this many people with complex disabilities getting old in community. So I think just like my parents' generation had to re-envision education, my generation needs to re-envision aging and what that looks like in community.
Thanks. Again, that was very interesting because it reminded me very much of a graduate student who came to do the Masters in Environmental Studies and was my student there 25 years ago or so at York University. Very much like you, probably about your age then. And she ended up, because she was trying to figure out how to get aging parents into a home and how to pick one, and discovered no one had written the book about it. So she ended up writing the book about it, published it, became a consultant in that area. That's what she used her master's to do. She has just, this year, and I just heard 2 days ago, been accepted to do the PhD in social dimensions of health here at UVic. So you might want to talk to her because she's got a wealth of experience of kind of doing what you're setting out to do. And I think you'd find her very helpful. So talk to me afterwards.
More a comment than a question. Kudos to you for bringing your heart and soul to this work. It's apparent that, you know, you've got the lived experience and it's meaningful to you. And just echoing on the other comments, you taking that further, I already, like, you're a leader in this work and there's a huge opportunity for you. As long as you know, when you're really truly connected to something and you're passionate about it, I see you going really far with this. So thank you for having that commitment. This is a huge issue. As you say, the aging population, the layers of complexity. Our work is healthy communities, and this is definitely a very important issue that impacts everyone in the community. So thanks for the amazing work.
Thank you. Yeah, there have been quite a few opportunities. My practicum placement, Inclusion BC, is letting me do an hour-long workshop on this at their conference next month. So more to come.
Good. Well, don't give up, that's for certain. Thank you very much.